Nigeria records 685 new COVID-19 cases on Sunday, raising total tally to slightly more than 131,000. Federal government says it is ready to commence the COVID-19 Rapid Response Registered Cash Transfer Program for urban and suburban poor. In international news, COVID-19 vaccine shortage wars continue in Europe, Spain not spared. And in sport, Odion Igalo sets to complete Saudi Arabian side Al-Shabaab's move.
This is ANN News.
I am Olajumoke Olatunji. The Nigeria Center for Disease Control, NCDC, has confirmed 685 new coronavirus cases on Sunday. That shot up the country's tally to 132,242. Death toll stands at 1,586. Sunday's record showed a decline in cases compared with figures reported in the last few weeks. NCDC reports the new cases were confirmed in 16 states, with Lagos back at the top with 355 infections. Kaduna and Nasarawa posted 58 and 46 respectively. 33 cases were credited to Akwa Ibom, while Katsina, Ogun, and Osun recorded cases in the 20s. Rivers, Edo, Oyo, Ondo, Borno, Ekiti, Kebbi, and Plateau states shared the rest of infections. 8 fatalities were also recorded from COVID-19 complications. Nigerian medical institutions, including COVID-19 testing facilities and quarantine centers, are facing mounting pressure following a surge in COVID-19 cases in recent months. As of Sunday night, the country had reported 131,242 COVID-19 cases, the 6th highest number on the African continent. The number of confirmed cases has ballooned since December. An NCDC testing site in Abuja's Central Business District offers free nucleic acid tests, but the site cannot issue complete reports to be used for the purpose of international travels. Most of the residents that patronize the sites are there with symptoms or because they have had close contact with COVID-19 patients. All who go there believe testing is now a necessity in the wake of soaring cases.
I think at this point it's helpful to me to be sure. So I wouldn't know if I had contact with anyone because the status is not on the forehead.
I came to know my status, and again, I think it's very necessary for me to know that.
Those who went through the test will receive their reports by text messages, and those with positive results will receive phone calls asking them to go to quarantine centers for evaluation to check if they need quarantine or treatment.
Currently, we have about 50 patients on admission, and then 5 of them are on oxygen. We're seeing average of 5 patients per day before December. We're seeing about 15 at times 20 patients in a day. That's massive. We discharge after 10 days from the day of tests. We no longer make use of that negative result again because you have to wait for a longer period of time. Once you've taken the drugs for 10 days, you are fine.
Nigeria is expected to receive 100,000 doses of vaccines from the Global Alliance for Vaccines and Immunization later this month. Although COVID-19 vaccines are not even in the country yet, Nigerians are already developing what correspondent State Department calls vaccine phobia. He explains what that means in this report.
The first batch of COVID-19 vaccines is expected to arrive in Nigeria before the end of January. The country hopes to receive 100,000 doses of the Pfizer-BioNTech vaccine by then and commence vaccinations immediately. But as the government prepares for this, it faces another big challenge: vaccine resistance, or what some have termed vaccine phobia.
I cannot internalize or use something something I don't have accurate knowledge of. If you look at what is going on globally, you will see that every country is coming up with their own vaccine. And in Nigeria here, look at it here, in Nigeria, we don't really have the technological know-how. Even most of the doctors we have and some of the hospitals we have, we don't really have those equipment to really test this vaccine. So to me, I cannot really use it. I have to see the effectiveness in other people first before I can adopt it.
I can't say the COVID-19 vaccine. Reason is that I'm not even sure maybe the drug is well tested or not. So I can't buy it or I can't even take it.
What happens if at the end of the day the vaccine is administered and it doesn't work for me? So what's going to be the consequence?
Religion is also a fundamental reason for the vaccine phobia here. Some influential religious leaders do not even believe in the existence of COVID-19 and are discouraging people from taking the vaccine. And in a country where religious sentiments are high, quite a number of people are listening to them. The government must now tackle the pandemic on one hand and on the other, sensitize people about vaccines.
We must acknowledge that the average non-health worker may not necessarily have all the information required to make an informed decision. We must continue to not only offer the vaccines, but we must put in the hard work, the effort, the time, and the resources that are required to inform the general public. So that understanding around the vaccine needs to improve, and I'm sure that many people will come around.
The government will need the help of religious and traditional leaders, as well as social influencers, to raise awareness about vaccines before the start of mass inoculations.
The federal government says it is ready to commence the COVID-19 Rapid Response Register Cash Transfer Program. This is an intervention by the federal government, the Federal Ministry of Humanitarian Affairs, that would be centered on urban and semi-urban areas that are economically impacted by the COVID-19 pandemic. The target group will include the urban poor and vulnerable population not yet supported through the existing National Social Safety Nets projects. The program will also cover non-traditional poor in urban and rural-urban high-density locations and slums that have been impacted by the pandemic. To qualify for the program, individuals or heads of household must first pass validation checks to establish the pandemic's impact on their means of sustenance. To apply, contact the Disaster Management and Social Development Department of the Ministry of Humanitarian Affairs. And for more information on this story, visit our website at www.annafrica.tv. An appeals court in The Hague has ordered Shell Oil Company to pay compensation to Nigerian farmers in the Delta region for oil spills that had polluted a large part of their land. After 13 years of litigation, The Hague has also ruled that Shell's parent company, Royal Dutch Shell, is liable for installing new pipeline equipment to prevent further devastating spills. Shell Nigeria says it is disappointed by the verdict. Farmers in Goy Oruma and Ikot Ada Udo in the Delta region had sued Shell in 2008. A lower court in the Netherlands had found Shell liable in 2013 for one leak, but held that Shell's parent company could not be held liable in a Dutch court. In 2015, the Hague Appeals Court ruled that the courts actually had jurisdiction. On Friday, the court ruled in favor of the Nigerian farmers and ordered Shell to pay restitution. Coming up, African stories. WHO warns new variant of COVID-19 could prolong second wave on the continent. And later, international news. COVID-19 vaccine shortage wars continue in Europe.
You are watching ANN.
This is a public service announcement on your national identification number, NIN. First, dial *346# to get your NIN and write it down. This will enable you link your NIN to all your numbers easily. You can now use any of these 4 ways to link your NIN to all your MTN lines. 1. Dial *785*NIN#. 2. Visit My MTN app. 3. Visit www.nin.mtnonline.com. 4. Text your NIN number to 785. Remember, this includes your data SIMs and other alternate lines. For those without NIN, visit the NIMSI website to find a registration location. Avoid disconnection. Link your NIN to all your MTN lines before 9th February 2021.
Welcome back. This is ANN News. The World Health Organization's Africa Regional Office has warned the discovery of new variants of COVID-19 in several African countries could prolong the second wave on the continent and could overwhelm its already fragile public health systems. WHO Regional Director Mashidiso Mote sounded the alarm last week over the spread of newly highly contagious strains of the coronavirus. Moite said the variants could undermine efforts to flatten the curve of the infections rates of the virus on the African continent. The WHO director said the South African variant is believed to be behind the unprecedented surge in infections cases that has hit Africa's second largest economy. And so far, 6 African countries and regions, Botswana, Ghana, Kenya, Mayotte and Zambia, and 24 countries outside Africa have confirmed the presence of cases of the variant. In addition, variants initially discovered in the UK have been recorded in the Gambia and Nigeria. And currently, Moite believes the second wave of the pandemic is overwhelming the medical systems of many African countries. Well, speaking of the South African variants, the country has been hit hard in all spheres of its economy. South African travelers have been barred by many countries, but South Africa is trying to find ways to boost its economy, even in the midst of the COVID-19 surge. It has launched a multi-million-dollar fund to shore up its tourism sector. Correspondent Yelisa Injamela reports.
Tourism-dependent businesses have suffered major economic losses as a result of the COVID-19 pandemic. Amongst other things, land border closures and travel restrictions have meant fewer holidaymakers are making their way here to South Africa. The tourism industry is regarded as one of the key contributors to this country's economy.
Tourism directly accounts for 2.9 or thereabouts of South Africa's GDP. And they also account for 8.6% indirectly. Now, this industry supports about 1.5 million direct and indirect jobs. This is a sector that is, in the main, labor intensive and therefore has immense job creation potential. It supports a vibrant and complex value chain.
President Cyril Ramaphosa was speaking during the virtual launch of the Tourism Equity Fund. The fund will be used in particular to help black entrepreneurs enter the tourism sector with better ease.
If the tourism industry is to play its role in aiding the economic recovery in the wake of COVID-19, it must grow and transform. So this effort that we are all about today is going to contribute to this sector growing, but at the same time it must transform. A fund that facilitates the participation of black entrants, but also more importantly, facilitate the entrance of women enterprises and persons with disabilities.
Small black-owned businesses in the tourism sector can, in the next 3 years, receive funding to elevate their enterprises. During the launch of the fund, the president emphasized that while the COVID-19 lockdown has had a devastating effect on the tourism sector, he's confident that it will bounce back because of its resilient nature.
Tourism will come back. as it has always come back in the past. It will continue to contribute in an immense way to the economy of our country.
The South African Economic Reconstruction and Recovery Plan, a plan touted to revive the country's economy, has identified the tourism industry as one of the major priority areas.
When we return, international news. COVID-19 vaccine shortage wars continue in Europe, Spain not spared. And later, sport. Igalo sets to complete Saudi Arabia's side, Al-Shabaab's move.
You are watching ANN.
Welcome back. This is ANN News. A military coup has taken place in Myanmar, also known as Burma, and the junta has detained elected leader, Nobel laureate Aung San Suu Kyi, along with other leaders of her National League for Democracy. The army says the detentions were in response to election fraud. Military Chief Min Aung Hlaing, who is also now in power, has imposed a one-year state of emergency, after which it says there would be new elections. The coup derails years of Western-backed efforts to establish democracy in Myanmar. Meanwhile, authorities will continue the battle against the COVID-19 pandemic and boosting economic recovery. COVID-19 vaccine shortages continue to plague many European countries. The European Union is working with vaccine manufacturers to overcome delivery delay problems. Spain has not been spared in the continuing vaccine wars. The country is grappling with a slow rollout of COVID-19 vaccines, even as coronavirus cases surge. Correspondent Rahul Pathak reports.
Spain will aim to have 70% of its population vaccinated by July. The words of Spanish Prime Minister Pedro Sanchez back in November. Fast forward to the end of January, and Spain's two biggest regions, Madrid and Catalonia, are now running short of vaccine doses.
It's a problem having to start a vaccination campaign that requires 2 doses and then having to postpone it because of shortages or distribution problems. That is not to say that just having the first dose is totally useless, but ideally we would like to finish the vaccination process, to finish what we started.
Now, with Spain currently in the grip of the third wave of the pandemic, this couldn't have come at a worse time. The latest figures from the country's health ministry reporting over 40,000 new infections over a 24-hour period and 492 deaths, figures not seen since April last year and the worst days of this crisis.
Being young as I am, it doesn't worry me that much, since I should be more immune or have less risk of dying. But for old people or people that have diseases like asthma, it's important that this programme rolls out. The faster, the better.
I think they should be faster. This is something we all need. It's been a while already since they announced that vaccination was starting.
Madrid's regional governments say they will halt new vaccinations for the next 2 weeks and concentrate instead on giving second doses to those who have already had jabs. European Union guidelines state the second dose can be administered up to 45 days after the first shot.
U.S. President Joe Biden has signed many executive orders during his first month in office, and he is still signing more. He has signed executive orders on climate change, COVID-19 measures, and racial parity in the country, just as communities of color in the country begin to demand racial action from his administration. And correspondent Dan Williams reports.
Empty plots line the streets of Kenosha, Wisconsin, where businesses once stood.
What do we want? Justice!
The protests here followed similar scenes witnessed across the nation after the deaths of George Floyd and Breonna Taylor. Justin Blake is Jacob Blake's uncle. He's optimistic for change under a Joe Biden presidency.
We think Joe Biden's one of those guys that's going to put his everything into making sure this happens. Not far off in the future, but today. He understands how significant, how important it is to our community to see something tangible within the first year, within the first 6 months.
This park outside the Kenosha courthouse was the focal point for protest groups following the shooting of Jacob Blake. Although quiet now, anger within the community remains. But for many groups here now, the focus is on implementing real change and addressing the root causes of systemic racism and social inequalities. Tanya McLean is the executive director of Leaders of Kenosha.
If you're worrying about, how you're putting food on the table, you're not worrying about what's going on at the city council meeting. The president, yes, it's a big deal, but it's about the local stuff.
The movement to defund the police became a rallying cry at protests across the country, while Biden does not support the concept, arguing instead that police need more funds. He is promising investment in community services and violence prevention.
We live in food deserts. And then in the community, black and brown communities, the education. The education is the worst. If we had resources in our community, we wouldn't have so much mental health or unemployment, because people would want to work. People want to be productive citizens.
Economic inequalities have been laid bare in recent years. Black home ownership is at its lowest level in 50 years. Biden's proposals include boosting lending to entrepreneurs of color and restoring infrastructure in minority communities.
Rebuilding public housing, that's new for the United States. And a lot of public-private investment partnerships to invest in black and brown communities. So I think we'll see some redirection of resources on a fairly large scale into black communities.
Michael Dawson of the University of Chicago believes it's a race against time for Biden to implement his policies, given the Democrats are also currently in control of both houses of Congress.
In the first 2 years, this is the time to go big, not small. This is not the time for incremental change. If you want really transformative programs, now is the time to launch them.
There are high expectations of significant change under President Biden. Communities of colour across the nation will be watching closely to see if policy can take a major step forward.
It was exactly a year ago that China's Spring Festival travel rush and celebrations were decimated by the onslaught of coronavirus. This year, there is calm. And now the Chinese annual Spring Festival rush has kicked off again with COVID-19 precautions.
Travel flow for the Spring Festival this year may be slowing down, but there's no let-up in epidemic prevention and control measures at Beijing's railway stations. Passengers scan the health kit QR code and go through temperature check machines before entering. Signs on the floor remind them to keep a 1-meter distance on platforms and in the waiting rooms. Every train has been disinfected before it departs.
Disinfection will be carried out every 4 hours on every part of the train during the journey. While moving through medium and high-risk areas of China, the disinfection will be done every 2 hours.
In South China's Guangzhou station, travelers have been advised to wear masks, get their health codes ready in advance, and avoid taking food and drinks on board.
It feels like there are very few people traveling this year. There used to be a lot more passengers. I had to show my health code all the way, whether it's the subway or the railway.
To ensure fresh air circulates inside the trains, the newly opened Beijing-Harbin high-speed railway cars optimize their ventilation system on the Harbin section.
The fresh air supply of different types of trains has improved by 17% to 33%. The bullet trains can ensure proper ventilation every 5 to 10 minutes.
China's Spring Festival travel rush is regarded as the world's largest annual human migration. People in the country usually enjoy a week-long holiday with family to celebrate the Chinese New Year, which begins February the 12th.
Up next, sport. Igalo sets to complete Al-Shabaab's move. Please stay with us.
You are watching ANN.
We are on the road every day, canvassing throughout Africa for news you really need. We follow the story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Welcome back. This is ANN News. In sport, the Nigeria Basketball Federation has officially confirmed coach Ufom Udofia will lead the Tigers to the 2021 AfroBasket qualifiers in Tunisia. Ufom joined the seniors men's national team technical crew just before the 2019 FIBA World Cup. He's taken the place of head coach Mike Brown, currently tied down by Golden State Warriors. Meanwhile, coach Alex Nwora, who remains a vital part of the D Tigers crew, will also be missing for family and personal reasons. Super Eagles top striker Odion Igalo is expected to join Saudi Arabian club Al-Shabaab after he undergoes medicals. 31-year-old Igalo recently completed his long loan deal with Manchester United from the Chinese side, Shenhua. Although he was due to return to his parent club, Igalo was given time to speak to the Saudi Arabian side. That is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatunji. Have a pleasant evening.